Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, really dark, impacted, stubborn earwax. And this is their right ear, which is the worst one out of the two. They last attended about 4 years ago, which is not bad going if you are an earwax sufferer. Around 10%, give or take, of the population do suffer from earwax impaction. That's mainly for the UK. It may, of course, be different around the globe in different parts of the world. And I would say typically if you are a wax secretor, well, let me just rephrase that actually. We all secrete wax, but if you're someone who suffers from ceruminosis, where not only do you secrete wax, but it builds up in your ear and it doesn't naturally escape and come out. I would say typically every 18 months or 2 years you would need your earwax removed. Of course, that varies significantly though. I've got some patients that have to attend probably quarterly, other patients who it's every 6, 7, maybe even longer years. And so 4 years actually is not bad going if you are someone who suffers from earwax. This particular earwax was very dry and it was stubborn, it was lodged deep in the ear, it was fully occluded. I got the more lateral earwax out, combination of microsuction and a St. Bart's ear hook. And this wax, as you can see, it's deeper in the ear, it's lodged. It's tricky getting a suction grip when you've got wax like this, because it is quite dry. So I've just used some medical grade olive oil spray. The particular olive oil I use, it's from a company called Clear. I have to declare my conflict of interest. I'm their healthcare advisor. However, before accepting the position, I really did my due diligence on their products, and I'm really pleased with this spray that I'm using in clinic day to day. If you are someone who wants to purchase it, please visit our website, www.clearwax.co.uk. You can see the URL bottom right of screen, and visit our public online shop where you can purchase it and you'll get it shipped out to you. It's only available in the UK, or should I say we only sell it in the UK ourselves, but we're hoping to expand and hopefully find some distributors across different parts of the world. So what the olive oil does, it just softens the surface of the wax plug, and just by softening it, I can get a better suction grip. And I've brought this forward, now it's just lodged at the entrance, and in a minute you're going to see this tear away because the entrance is quite narrow. You saw there, the wax plug got trapped. And this patient had really beautiful hair, I must admit, very curly, but it was very difficult to keep behind the ear even with a hair clip there, so it was kind of just above shoulder length, but there's strands coming out. So some of the times as I was going with a Saka, I was attracting those hairs and it was going inside the ear with me, so you may have seen that on a few occasions. I'm just going to now remove some of this wax off the anterior canal wall. There's one of those hairs I mentioned. I think the patient had been scratching their ear. You might have seen at the entrance it's a bit red. Should have mentioned that at the beginning. So I did ask, but they said no, but it was a bit almost like a little scratch mark there. The eardrum is visible in the distance. It is quite a bendy ear canal, so all we can see is the posterior aspect of the eardrum, which is the back part. That's in part because I've got the endoscope angled in such a way because I want to focus on the front part of the ear canal because I'm peeling away this dead layer of skin. But even when I center the endoscope in the ear, it was quite bendy. It veers off from left to right. So this skin, it's quite thick. It's quite adhesive layer of skin. I'm just pulling away. You've got to be careful it doesn't clarinet. When we suction dead skin, there's a tendency for that skin to violently flap at the edge of the sucker. And when it flaps, it emits a very loud and high frequency squeal. It's not only loud for the patient, but also myself. Guys, whilst you're watching this, I know I've not been uploading as frequently as usual. Normally I'm probably 5, 6, maybe even every day of the week I upload. Just very, very, very busy at the clinic. I'm doing quite a lot of media work. Also, there's a few things going outside of work. So just bear with us. Even this, I just thought I'll upload it. I've got to be somewhere a bit later. So, but I actually enjoy doing the videos. Truth be told, it helps me to relax as well. So everything's okay, so don't worry. But yeah, I've just been extremely busy, both at the clinic and away from clinic, and things should ease off a bit mid next week. So this is patient's left ear. This one came away in one singular piece. You can see it is quite a large dry piece. You can see all the skin adhesions. That skin you probably saw at the bottom. You can still see it there. So that skin is a fresh layer of dead skin that's on its journey of shedding off the ear canal, and that skin attaches itself to the underside of the wax plug in this case. So it means when you remove the wax, you have to detach it from that skin. The eardrum is visible. So this ear is less bendy. There is a bit of a dip as you go up the ear canal, which most of us have. We have this upwards incline, then about a half a centimetre away from the eardrum, it dips downwards in the case of the left ear, to the left. And that creates a trench, a dip, an inferior recess, and also an alcove to the front part of the ear canal. We call that the anterior recess. Again, you can see those hairs. Now, we did pull these hairs back, but they just managed to get attached to the sucker. The patient did suffer from the gag reflex. When you sometimes suction in the ear, especially the back part of the ear canal and the floor of the ear canal as well, you've got a branch of the vagus nerve called the Arnold's nerve, and that can trigger a gag reflex. So we left it as that. Patients can hear significantly better. Well, I hope you enjoyed that video, guys. Take care, keep well, speak soon.